In some cases, a tooth is removed without immediately placing a dental implant. When this happens, the jawbone naturally begins to shrink due to a process called bone resorption, often leading to significant bone loss. This is a normal biological response and can make future implant placement more challenging. To ensure a strong and stable foundation for a dental implant, bone grafting may be necessary to restore lost bone. One common method is socket grafting, where bone graft material is placed in the empty tooth socket immediately after extraction. This helps preserve the bone and prepares the site for an implant after a healing period of about 4 months.